process. So thank you all, colleagues, Mr Deputy Speaker, Ministers, for listening to my comments this evening. Thank you to the Cotter family for being here. Britain is a world leader in medical research, and let's make sure that British patients, like my constituent Kate, can be among the first in the world and not the last in the world to benefit from medical discoveries. Thank you.
Minister.
Thank you, Mr Deputy Speaker. And can I also thank my honourable friend, for the member for Cheltenham, for the very... Sorry, I've corrected it on my brief. I know if she's Chelms, but I ought to know if she's Chelms, so she's a near neighbour of mine. But to thank her actually for the very passionate and articulate way that she's made her case this afternoon. I'm actually very proud that it's me responding to her first adjournment debates, because she and I go back a very, very long way. So can I thank her, and I hope to give her some comfort about the fact that we are taking into consideration some of the issues that she's raised today. Can I also thank the honourable gentleman, the member for Strangford, who again made a very articulate pitch on behalf of the families of people who are suffering from rare diseases. And we do need to always remember that when dealing not just with the person with the condition, but the burden on their family can often be as great, if not greater. So we do bear that in mind. So my honourable friend, the member for Chelmsford, has raised this debate on phenylketonuria and treatment with KUVAN, setting out on behalf of all PKU patients their concerns, which I hope to address. The importance of addressing rare diseases, of which PKU is one, is increasingly recognised by policymakers and healthcare service providers, not just in the UK, but worldwide. Mercifully, the numbers of patients suffering from each rare disease can be small, but collectively 3.5 million people in the UK alone are affected by rare diseases. And to put this number in context, this is 1 in 17 people who will suffer from a rare disease at some point in their lives. So the government is dedicated to improving the life of patients with rare diseases. This is laid down in our promise to implement the 51 commitments of the UK Strategy for Rare Diseases, and that includes the need to take account of new evidence that may emerge as a result of research and development. Now, many rare diseases are present at birth or soon after, and PKU is no exception. We understand that PKU has an estimated prevalence of 1 in every 10,000 births. And we know that without treatment early in life, the outlook for those born with PKU is very poor. Without appropriate treatment, as my honourable friend has outlined, people will develop severe learning disabilities, which may lead them to require constant care. But with treatment, the outlook can be good. Screening, therefore, has a vital role in early and accurate diagnosis. The current newborn screening programme in the UK is based on the blood spot or heel prick test and screens for 9 rare conditions, including PKU. Treatment can then start straight away, minimising the risk of serious complications. As I understand it, for patients with PKU, this treatment includes a special diet, confining intake to low-protein food and regular blood tests, as my honourable friend has explained. Now, I do recognise that this protein-restricted diet can be very limiting and particularly difficult for children to adhere to. Young patients with PKU cannot eat many of the enjoyable foods that we all eat each and every day, such as meats, milk, cheese and fish. So undoubtedly, this does put a strain on patients like Kate and their families, and I'm very pleased that they're here witnessing this debate today. It can make simple day-to-day activities like going to school or meeting friends a significant challenge. And I also appreciate the immense pressure it must put on parents and carers to stop a child from the pleasure of choosing and eating a wide range of food on a daily basis. We all understand the desire of young patients to live a regular life, eat any food that they like and not have to worry about the consequences. But because of the extremely limited number of naturally low phenylalanine foods available to PKU patients, mainly fruits and vegetables, they also need supplements to meet daily energy requirements, add bulk to their diet and increase variety. And my honourable friend has outlined some of the protein shakes that they have to rely on to do this. The availability of those low-protein foods and nutritional supplements through the NHS is still very important and has, since its development by Birmingham Children's Hospital in the 1950s, saved the lives and improved the outcomes of many PKU patients. But let me move on now to address specifically the point she's made about the medication KUVAN, which has been found to lower blood phenylalanine levels in some patients with mild or moderate PKU. As highlighted today and in previous debates, this drug is unfortunately only effective in some patients, and that is entirely dependent on their particular genetic makeup. It is most likely to benefit those with milder forms of PKU, and in those cases where patients respond to treatment with KUVAN, it means they're still likely to be required to continue with some form of dietary restriction. So NHS England currently has a policy on the use of KUVAN for the management of PKU during pregnancy, and it's targeted to patients who are not able to establish low levels through dietary control alone. Keeping mums-to-be safe is of great clinical importance to prevent maternal PKU syndrome and lifetime adverse consequences to their babies, the worry of which may further increase a mother's anxiety around pregnancy and the worry about their developing baby. The reason KUVAN is currently not routinely commissioned for use in children and adults is due to the lack of evidence of its effectiveness on nutritional status and cognitive development at the time the policy was developed back in 2015. However, if doctors treating a patient think they would benefit from treatment with KUVAN, clinicians are able to make an individual patient-friendly request, as my honourable friend has said. Now, I appreciate that what she's asking me for today is for a bigger change than that, beyond access for an individual patient, namely a wish to see a change in the commissioning policy on KUVAN for the use in children and adults that respond to the drug. As I've mentioned in my opening remarks, it is important to take account of new evidence and developments as they emerge. And I'm happy to report that NHS England has received a preliminary policy proposal for the use of KUVAN in the management of PKU for adults and children, as new evidence has now been published to support its use. This was considered by the clinical panel in January, where it was agreed that NHS England should undertake a further review. NHS England is now working with NICE to agree the best approach to this, and has asked NICE to consider developing advice on the use of KUVAN. I hope my honourable friend will accept this as a positive step in the right direction. I also agree with my honourable friend about the need for good stakeholder engagement. Taking stakeholder views into account is vital in any decision-making process, and that will involve members of the public and patients, including Kate and her family, and all families who will be impacted on this. I'm very pleased to hear the point made by my honourable friend that Biomarin, the manufacturer of KUVAN, is very open to negotiation on the pricing of the drug. That's extremely welcome news. And indeed, as part of any review process, manufacturers will be able to offer a patient access scheme to NICE, and the price offered is then considered to determine the cost effectiveness of the drug. So I do hope I can reassure you today that discussion on access to KUVAN is actively being considered. The Department will follow NICE and NHS England's upcoming work with great interest as they consider the impact of new evidence on commissioning policy. I just want to emphasise that research is crucial to improve our knowledge of rare diseases and to work towards better treatment of them, and I'm pleased that the UK is recognised as one of the leading countries for research into rare diseases. And in July 2017, the Chief Medical Officer published her landmark report setting out a vision for genomic medicine in the UK. The Government has accepted that report in full and responded with the establishment of a National Genomics Board chaired by my colleague Lord O'Shaughnessy. I hope this reassures my honourable friend and the House of the Government's real commitment to support research aiming to bring real change to the way we understand and treat rare diseases. We are in a fantastic position in the UK, at the forefront of that science, and it is our patients that play such a vital role in challenging us as policymakers, as healthcare professionals and researchers to find new treatments for the benefit of all. So to conclude, in going forward, we will ensure that we harness the remarkable prospects that these new developments present for the benefit of our rare diseases patients. We will look more closely at KUVAN. NHS England and NICE will be reviewing the new evidence and will engage with BioMarin to consider whether KUVAN should be made available more widely. I'm very grateful to my honourable friend once again for highlighting these issues, and perhaps through her, as I close, I extend my very best wishes to Kate and her family as she battles with this disease.